Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take action to try and make a better system for all of us. Today we're going to be talking about privatization in healthcare and some legislation in Congress. Before we do, down below in the YouTube description box is a link to the Healthcare Advocacy newsletter that is actually the text for today's video. You can go there, subscribe for free. All the references I mentioned and medical studies and stuff, all of that is in there, together with a lot of other healthcare resources you might find useful. Let's talk about privatization first. As an example of what happens when we privatize, here's an example in England. There, the government of John Major, this is a long time ago, sold off the public rail system to private industry. There's been less maintenance and upgrading of equipment. In fact, if you ask in England, it's called old rolling stock on rails because everything is so outdated. The train schedules are now more of a suggestion than a mandate, and the costs increase regularly. I understand they go up at least twice a year. The rail system in England for more than 100 years had been the measure of how a well-run government could provide critical infrastructure to constituents, an infrastructure that they needed. Now it's more of a vehicle to squeeze out profits at the expense of consumers. Now the same thing is on track to happen to Medicare. And the reason that this is important is that it highlights the ways that the goalpost for universal health care is being moved farther and farther away. Medicare Advantage is not Medicare. I'll do a little background material. Traditional Medicare is an 80-20 plan. That is, the enrollee pays 20% of the cost and the insurance company, the government, pays 80%. Now, for a little money, you can, if you're healthy enough, buy a supplemental insurance plan to cover most of that 20%. And for little or no money, you can get a prescription drug plan. Medicare Advantage Part C is a network-based system where private insurance companies receive a monthly payment from the U.S. government, about $1,000 a month per enrollee. But almost every company upcodes. That is, they report that enrollees are sicker than they are and pick up an extra $800 a month per enrollee. The Department of Justice often goes after them for fraudulent upcoding, but it takes years to get the money back. Now, the other problem with private insurance is that they make money by keeping the premiums and not paying claims. So they have all kinds of shenanigans. They have pre-authorizations to deny treatment or to slow roll it. They have just outright denial of claims. And quite frankly, a lot of those denials are based on their alleged empirical data, not what's medically known to be the correct treatment. We talked about one of these earlier this week where they actually killed a patient. I think it was Blue Cross of Illinois. They killed a patient who needed a surgery and chemotherapy for stomach cancer. They denied treatment. He dropped dead. Lucky for them, they get to keep the money, but his wife and orphans, not so lucky for them. Anyway, a recent story in MedPage Today highlights how privatizing this critical infrastructure, healthcare, going to Medicare Advantage instead of Medicare, isn't always the best thing for the consumer. During a recent study, they found that Medicare Advantage plans were paid about $37 billion a year more than the taxpayers would have spent on traditional Medicare. Of that, it was actually about $40 billion that was paid to the Medicare Advantage plans. They kept $37 billion, and about $3.9 billion was what traditional Medicare enrollees would have. That's what those services would have cost. So they're just raking in money hand over fist for no good reason other than to pay profit and overhead. Now, even though most Medicare Advantage plans boast of additional supplemental coverage that you don't get with traditional Medicare, usually dental, vision, and hearing, the enrollees didn't get more care than traditional Medicare patients, and they pay out of pocket almost exactly the same. They found that people getting glasses were paying slightly less, about $225 rather than $250 for Medicare, traditional Medicare patients. P.S. if you're paying that much for glasses, send me an email at healthcareadvocacy1@gmail.com. I'll tell you how to get glasses way cheaper. Hearing benefit, the number of them that use hearing aids is about the same, 13%. A Commonwealth Fund report found that 31% of Medicare Advantage enrollees never use the supplemental benefits at all. 58% don't use dental, 59% don't get their vision checked, 93% don't use the hearing benefits. So this is a lot of stuff that is just useless and very expensive. Anyway, it's a trick that they use to pull people in to enroll in the plan. It looks like you're getting more, but out of pocket, you're pretty much paying exactly the same. Oh, P.S. for dental, there's a standard trick in the dental trades. Probably dentists don't like to say it out loud too much, but they bill insurance almost twice what the cash price is. So when you go to the dentist, you should always say how much for cash, because most of them will have a huge discount for that if they don't have to go through insurance. And regarding that hearing aid benefit, I was shocked because my hearing is damaged, and so we went to get hearing aids for me. And I actually shopped them around through my medical provider. It was a fortune. They wanted about $8,000 for hearing aids. The deductible was going to be $1,500. And I'm sorry, the copay for me was going to be $1,500, not the deductible. So it was still going to be expensive, but I know that my insurance company was going to negotiate down the price. We ran over to Costco for a similar hearing aid. Guess what? $14.99 out the door, no tax in my state. You know, it's just a huge fraud on the United States taxpayer and on patients. It's just horrible. Anyway, so all in all, what Medicaid Advantage really does is force the U.S. government to pay an extra $37 billion a year over traditional Medicare. And as I said, that's going to go up to about $82 billion in the coming years. So look, I know Elon Musk is out there ranting and raving about saving the government money. I've got a way to save money. Get rid of Medicare Advantage. Wait, you can do better. According to the Congressional Budget Office, in 2020, they determined that the country as a whole wastes $400 billion every year by using private insurance instead of a universal health care insurance trust. And save another $200 billion a year just by negotiating all the drugs and getting the pharmacy benefit managers out of the loop. Our country could save $600 billion every year just by having universal health care. And we would all get better coverage, better care, cradle to grave. So if politicians want to cut the budget, implement universal health care. I want to talk to you now. This is really important. We need to oppose oppression. And I got to tell you, your help is really needed to do this because we can't let bullies and authoritarians get away with it. Bullies and authoritarian governments operate in much the same way. I don't know if you had bullies when you were in school. I sure did. And I was always on the wrong end of it. They pick on a weak target. And if they get away with it, they continue. And they expand their attacks because they get away with it. So you have to not let them get away. That ploy is underway in our country. The disgraceful U.S. House of Representatives passed a bill, H.R. 28. It is called the Protection of Women and Girls in Sports Act of 2025. The bill generally prohibits school athletic programs from allowing individuals whose biological sex at birth was male to participate in programs that are for women or girls. Now, before we go too far, do you know how many people are in college athletics that are transgender? This is out of a nation of more than 335 million. I know 10. It is 10 people. This bill, which passed the House, leaves open how schools will decide who's a man and who's a woman so they can keep their Title IX funding. I can just hear the gym teacher ordering students to get undressed so we can examine you. We'll do it in private Maybe, and that's just rife for sex offenders. What an entree for sex abuse in schools. This is much as we saw, I believe, with Dr. Nasser and his assault on hundreds of gymnasts in U.S. gymnastics. Moreover, how many women or girls do you think are going to be willing to get undressed and show their genitals to the gym teacher? I am willing to bet it is a small number, and so this is just an assault on women and girls, and they're going to be exiting gym programs right and left. The hypocrisy is disgraceful. Not just, anyway, the hypocrisy in all of this is disgraceful, and pay attention to it. They, the MAGA right Republicans, want less government, but they want to examine every student's genitals in law. How invasive is this? This piece of discrimination passed the House and it's on its way to the Senate, and it needs to be stopped. Remember, they don't stop at trans people. Immigrants will be next, legal and without documentation. Muslims not far behind, remember the Muslim ban, because the goal is to have a country that is run by white male Christian nationalists. That's what's in Project 2025. They want this thing to be a white male Christian nationalist country run on alleged biblical principles, which are not the rule of law. So we have to oppose them at every stage. So let's oppose them. I have an action for us to take, and this is unusual. I don't usually do it this way. I'm going to recommend that you send the ResistBot message below on your cell phone and call your senators. Call both of them, because they need to hear this over and over and over again. Urge them to not pass the discriminatory H.R. 28, Protection of Women and Girls in Sports Act. There is a link that will be in the YouTube description box where you can get their phone numbers, and then grab your cell phone and send a text message. The message is sign, SIGN, space, PYJJQE. That's sign, PYJJQE to 50409. I'll read you the message you're going to send. It's pretty much everything that was up above. I'm your constituent, and I see that the House passed H.R. 28, the Protection of Women and Girls Act in Sports of 2025. I strongly urge you to vote against it. The bill makes it plain that there will have to be genital examinations of those who want to participate in sports. How many girls or women do you think want to go through this? This is the first line of attack. This is first an attack on women. It's also an attack on the transgender or LGBT community. Now, they are a tiny minority, and if no one stands up for them, then the MAGAites will pick another group to assault in their quest to turn our country into a place for white Christian nationalists and no one else. Remember, immigrants, legal or otherwise, are next, then Muslims, then who knows? And it's up to us to stop them, and I need you to stand up to authoritarian bullies and say no, and vote down H.R. 28. I am counting on you. Thank you. Okay, please take the action. Remember, call and do the ResistBot. Those offices need to be just filled with this message. Down below, like, share, subscribe. You can get the healthcare advocacy newsletter for free. I'm happy to send it to you. You can also send me comments or suggestions here or at healthcareadvocacy1@gmail.com. I got to tell you, both these stories came because somebody shot me an email on this stuff. Okay, have a good weekend, and we'll talk next week.